An anterior hip replacement, or what sometimes is referred to as a direct anterior hip replacement, is just another way in which we do a hip replacement, which is removing the ball of the hip joint and replacing the socket side with implants. And this is done through a different approach where we really don't cut the muscles, we actually move them aside and work between muscle groups, and kind of in a more minimally invasive way can get in and out of the hip joint and allow patients to recover a little bit faster. Most of the time the incision is only about 10 centimeters or less from an anterior approach. We're able to do that in a lot smaller a manner just because we're not having to cut through so many muscles to do that. But again, we do as much of an incision as we need to get these implants in correctly. And so if someone is 6'7" versus someone who is 5'2", the incision is going to be a little bit different in size because that patient's bones are going to be different in size. And so the size of the implants that we use is also based off of someone's stature and their bone size. And we have multiple options available to us to use to make sure that we get the right fit into your bone. So we do lots of different approaches, and all of those are based off of various factors that we as surgeons and you as a patient provide to us and what we have to make our decision for. Some of those factors become someone's weight or size, distribution of other tissues, and or prior surgeries that you might have had that might make it more difficult to do one approach versus the other. So we do all the approaches that are out there. It just depends on those factors, and your surgeon themselves and you can make that decision together as to what might be the best option for you.